Welcome back to the Dr. Rich channel. As you all know, I'm a famous robotic surgeon, so I will now famously react to robotic surgery TikToks. Robotic surgery is an important tool that surgeons use to perform minimally invasive surgery, and specifically for gynecology, the treatment of endometriosis. Let's check out these videos. So robotic surgery is a tool that essentially allows for surgery to be performed with little tiny incisions. With traditional surgery, a surgeon will actually create an open incision, kind of like a C-section or up and down incision, anywhere from 8 to 20 centimeters long, and place their entire hands inside the patient to perform the surgery. The robot uses little tiny instruments that delicately, meticulously perform the surgery, and it allows for a type of surgical precision and dexterity in performing surgery that frankly is beyond the ability of what a surgeon can do with his own hands and with much smaller incisions. So no matter how you do surgery, your guts are going to get rearranged. The robotics allows you to do it with the least amount of tissue trauma, the least amount of bleeding, and the fastest possible recovery compared to doing an open incision, not to mention the cosmetic benefit of little tiny incisions as opposed to a big open incision. And just as a robot nerd, I'll point out the fact that there aren't 5 robotic arms, there are only 4 arms. The 5th incision, or the 5th port site, is actually the surgical assist using his laparoscopic instruments for traction during the actual robotic surgery or the removal of endometriosis.
So first we get all the meds, we figure out what we need, we get it all on the bed, we stop for cuddles, of course. We pack a medicine bag of all the medicines I might need, fuzzy socks, t-shirts, TENS machine for the muscles, gotta pack that up. Got some hand lotion, gotta get my pills for the entire week ready just so I don't have to do that later. Got my pills, got my vitamin D supplements. Had to stop for more cuddles. I
mean, definitely cuddles, hands down. That's the way to go. Therapeutic animal cuddling is always in order. I'm trying to figure out why she's actually packing. So laparoscopic endometriosis surgery is outpatient surgery. So particularly with a surgical robot, the patient would come in the morning having fasted overnight, so nothing to eat or drink in the morning. They would have the surgery. Surgery could take anywhere from 30 minutes to 3.5 hours, depending on the extent of the disease. The patient would then go to the recovery room. They'll stay in the recovery room for another 2 to 4 hours, and then they go home. And so all of the medicines or anything else they would need would be waiting at home for them. So I'm trying to get my head around why she's packing for that.
Had to chug water, snacks, vitamin C, and liquid IV. And we got the whole bedroom ready, clean sheets. This is me the morning of, and then we just went for our last walk, and then I headed off. All
right, well, preparedness is always a good thing. I guess all of the packing is because she was recovering in a place that's different from her house. But again, you're not bedbound after the surgery. You can get up, move around, go up and down stairs. A typical recovery for a laparoscopic or robotic endometriosis surgery, the day of surgery and the next day, you're not gonna do too much. That's where the most pain from the surgery is gonna happen. And there are ways to minimize that pain. There are medications that can be given in the recovery area, and also kind of stronger narcotic medicines that the patient can take afterwards, as well as pain pumps or injections that can be used to further reduce the pain. But really, after the second day, there aren't that many restrictions. By day 3 or 4, you can drive, go to the store, do things around the house. Really, by 1 week, you're about 90% recovered. You only really need help or all this pre-planning, prepping for the first day, maybe the second day of surgery. Thanks for watching, and thanks to all those TikTokers out there that give us the opportunity to observe, inspire, and inform. Make sure to hit subscribe so you can check out all of our great videos coming at you every Thursday.